Good evening, everyone. I hope you can hear me. Hello. I just wanted to check if you can hear me, everyone.
Yes, we can hear you.
That's good. So it's time to start our webinar. I'll be your host again today, and my name is Caroline. And I'd like to welcome all of you to Egg Donation Friends webinar. And today, this time we're going to discuss the IVF treatment with donor eggs in Poland. So you will be able to find out more about the whole process in Poland, but also learn if there are any side effects of the late motherhood. And today we've invited Dr. Katarzyna Olszak-Wąsik from Gyncentrum Clinic, which is located in Katowice in Poland. And she will start again with the presentation, and after that we will have our Q&A session. Okay, and of course the presentation will take approximately 20 to 25 minutes, and then we will begin our Q&A session. And remember, you can type in your questions during the presentation, and the answers will be provided by the doctor after the presentation. Okay, I believe we can start. Dr. Katarzyna, can we begin?
Yes, of course, we are ready.
Okay.
So good evening to all participants of our webinar. My name is Katarzyna Olszak-Wąsik and I'm specialist in obstetrics and gynecology. I work in Gyncentrum Clinic in Katowice. This is South Poland. And today's topic is late motherhood and egg donation in Poland. Let me go further. As we all know, motherhood is one of the most important, durable, and intensive interpersonal bond, and nowadays more and more women, especially in developed countries, experience motherhood in 40 years of age or even later. And the main causes that delay earlier motherhood are career and self-development that really often build women's financial condition. And today, women struggle to create balance between their professional and personal life, their passions and interests. Pregnancy with age, female fertility decreases. We know it, but we also should keep in mind that with age also appear other problems. Age acts against healthy pregnancy. Late pregnancy because of concomitant general diseases is considered high-risk pregnancy. And among patients older than 45 years, hypothyroidism, asthma, hypertension, obesity, and diabetes are more frequent. So advanced mother's age is related to increased frequency of obstetrical complications. However, the influence of mother's age on neonatal outcome is much more controversial. We know that mother's age is recognized as independent stillbirth risk factor, even in healthy patients. We know that increased risk of miscarriage before 24 weeks of pregnancy or stillbirth in 24 weeks of gestation or later are related to mother's age, but also to her body weight and her previous obstetrical history, and I mean here also previous miscarriages. With advanced maternal age, also the probability of fetal congenital defects and chromosomal abnormalities increases. Okay. Older women are also in a group of a higher risk of premature delivery, and premature delivery is defined as a delivery before 37 weeks of gestation. And one of the causes of premature delivery is pharmacological stimulation of ovulation. Additionally, in women that are over 35 years old, premature placental abruption is more often, and this is related to higher frequency of hypertension, preeclampsia, and eclampsia that I will talk just in a few seconds. Next. So, many pregnancy complications in elderly women result from progressive age-related changes in endothelium, which is an inner part of blood vessels. Diabetes is one of the side effects of late motherhood, and we know that diabetes doubles the risk of miscarriage. Another possible side effect of late motherhood is hypertension, which is twice more common in women in their 40s or later in comparison to the group of young mothers. And we know that it does not depend on the premiparity or multiparity. Another side effect observed in elderly mothers is preeclampsia. This is really a spectrum of symptoms. Among them, we find hypertension, which is defined as systolic blood pressure over 140 and diastolic over 90, with concomitant proteinuria, which means losing proteins, with concomitant organ disorders or neurological symptoms and problems with coagulation or with intrauterine growth restriction of the fetus. So it means intrauterine growth restriction means that the fetus does not develop in a proper way and the body weight of the fetus is not appropriate. And it is caused by the insufficient blood flow through placental vessels. So the fetus is not supplied with oxygen and nutritional compounds. Among this preeclampsia, we've got also organ disorders. These can be renal failure, liver failure, or some neurological symptoms, and also hematological problems, especially problems that concern platelets. Platelets are responsible for appropriate coagulation. And older mothers have sometimes another problem. This is placenta previa, because older mothers with previous history of cesarean section or uterus surgery are in a risk of placenta previa, which during pregnancy is dangerous because of bleeding in early pregnancy and even dangerous hemorrhage later. We know, thanks to multiple observations, that advanced mother's age is in advanced mother age, the higher percentage of cesarean sections is performed, and it happens because of previous C-sections or myoma surgery, and these things impose other than longitudinal position of the fetus, which can also be another indication for the C-section. So we are currently observing that more and more patients over the age of 45 are willing to start treatment in our clinic. The oldest pregnant patient participating in Gyncentrum egg donation program was 52. In Poland, infertility treatment is possible for couples in a constant relationship, so married but also unmarried, We've got really no maximum age for female. We've got no BMI limit for the female. The donation is anonymous. Egg donation procedure means that the germ cells are donated from the donor to the recipient. They are all anonymous persons. But to start this procedure, there must be a medical indication to egg donation program. So among the most common, there are premature ovarian insufficiency, premature menopause, which is a result of surgery, chemotherapy, or radiotherapy because of cancer treatment. These are surgery injuries that result in low ovarian reserve. These are failed IVF procedures with abnormalities in oocyte maturation, but also egg donation should be taken into consideration find advanced risk of diabetes, increased amount of amniotic fluid in patients after oocyte donation in comparison to patients who underwent IVF with autologous oocytes. So it seems that the complications observed in patients undergoing IVF, both using their own oocytes or donated oocytes, are rather related to the IVF technique itself or other factors influencing infertility, mainly advanced maternal age. So using donated eggs by mothers with advanced age is as safety as with their own eggs, really. So let's go to donors requirements. So donor program in our clinic enjoys great interest. Every month we've got over 250 donors applications. Donors in our clinic are all in good general health conditions. They are free of genetic, viral diseases, free of addictions. These are all young women aged between 20 to 32 years. And they all have to meet very strict inclusion criteria. I must say that even more than 65% of them are rejected. So our donors all are slim. They are all of Caucasian race. So these are all Polish donors, and most of them have higher education level, and most of them are during their studies. We do very precise medical verification, asking them not only about their family background, but also about their hobbies, interests, and so on. We do it to perform the best matching between the recipient and a donor. So now what about medical requirements for the patients? Patients that want to start egg donation procedure should be in a good general health condition. Before the first visit in Gyncentrum Clinic, patients will be kindly asked to send us via email hormonal results, vaginal swab, cervical smear, and semen analysis if available. So it all will give our doctor basic information about the fertility, about your fertility, and it will help us to make decision about the treatment. And all the results should not be older than 6 months, really. So after the first contact via email, it's time to plan fertility journey to Poland. The first step is visiting our clinic, and it will take 1 up to 3 days. This is time to perform medical consultation with ultrasound scan, gynecological examination, and sperm analysis if necessary. At this stage, patients are qualified for the treatment. The second step is the step when eggs are fertilized with the sperm. And the third step is the longer. It requires about 7 up to 10 days of staying in Poland. But this third step leads to embryo transfer. So patients should keep in mind that this is the standard procedure timeline. So in cases of any unexpected circumstances like wrong test results, I mean here, for example, wrong pap smear, vaginal swab that requires antibiotic treatment, or when we observed abnormal development of the endometrium, the timeline of the treatment can be a little bit longer. Let's go to the first visit in detail. So the first step lasts about 1 up to 3 days and is focused on performing medical consultation. So the doctor will ask about medical history, general health condition, any additional chronic diseases, about last menstrual period, regularity of the periods, infertility treatment, if any, about previous pregnancies, including previous miscarriages. And after all examinations, patients are able to go home. You may receive medication to prepare an optimal environment for the implantation and growth of the embryo, but this decision really is made by a doctor. Then this is a time for matching between a recipient and a donor. So we check many features of the donors to obtain the best similarity to the recipient. And after finding your donor, you have really two options. One option is to use available vitrified oocytes of the donor and to prepare your endometrium for the embryo transfer. The second option is to stimulate the chosen donor, retrieve eggs, and perform IVF with given semen sample of your partner. Then the embryo transfer procedure is performed, but really everything depends on your timeline. So if you want to make your stay in Poland as short as possible, then the program with vitrified oocytes will be the best solution. In cases of younger patients, we transfer 1 or 2 embryos into the uterus, and the transfer of more than one embryo into the uterus increases the risk of multiple pregnancy. And we know from the beginning of our presentation that in advanced maternal age, multiple pregnancy may be associated with unfavorable obstetrics outcome. However, in exceptional cases, we transfer even 3 embryos, but this concerns women that are over 40 years old. So where do our patients come from? They are really all around Europe and world. The largest number of our patients treated at Gyncentrum Clinic is from Great Britain, Germany, France, Sweden, and United States. In Gyncentrum Clinic, our patients will meet experienced team of specialists. You will have also a dedicated medical coordinator that is responsible for your medical visits and also help to arrange your stay in Poland. And this coordinator assists patients from the time of pre-treatment planning and preparation through arrival until departure, guiding the patient through every step and providing all necessary information and support. What I would like to highlight is that we do not have waiting lists for our sites, and with our egg donation program, 4 embryos of good quality are guaranteed, and all programs and treatment possibilities are available on our website. So I think that's all about egg donation in Poland at Gyncentrum Clinic and about late motherhood. So thank you very much for your attention.
Have
Hello.
a few questions ready. So let's begin. We have a first one. I would like to know if the doctor does a consultation by Skype.
Yes, this kind of consultation is available. All you have to do is to make contact with our coordinators to make date and we can perform this kind of consultation. Already we did it.
Okay, thank you. Of course, if you would like that, then please just get back to us via patient@eggdonationfriends.com. We will be able to forward such requests to the doctor, of course. Okay. And we have another question. Why do you have only Caucasian donors?
Because we've got only Caucasian donors because all our donors are Polish women, so they are Caucasian race.
All right, of course. Thank you. Okay, let's take a look at another one. Do you perform fresh or frozen cycles? I mean, frozen eggs from donor.
Yes, so we've got two possibilities. We can perform frozen cycle and also fresh cycle. It depends on your timeline. So if the vitrified oocytes are available of the donor, of the chosen donor, we can perform it. And if you wish to have fresh eggs, it's also possible.
All right, thank you. Okay, if you could describe the process a little bit more, I wonder how many times I'd have to come to Poland to proceed the whole process. As I have 3,000 kilometers to Poland, I'm thinking about minimal number of visits.
So the minimum number of visits, I mean, coming here, it would be not less than 2, because at the beginning we should meet to perform a gynecological examination to look on all test results and to perform ultrasonography scan. And if everything's fine and we decide to prescribe medicines and the medicines are taken at home, then the next visit should be around 7 days of preparing endometrium. So that's the time you should go to Poland another time, the second time, and it will last for a couple of days really when we've got the decision that the endometrium is appropriate to prepare transfer. So twice, not less than twice.
Okay, thank you. We have another one from Piotr this time. Do you guarantee 4 good quality embryos on day 3 or 5?
We guarantee 4 good quality embryos, and this, whether it's day 3 or 5, it depends on their development, which is checked by our embryologist. So it depends. Yes, really.
Okay, first, thank you. Is there a charge for Skype consultation with doctor, and if yes, how much it is?
Yes, the consultation is available, and it's about 100 euros for the consultation.
Of course, if you, as I said, if you are interested, then you can get back to us and we can ask the doctor to contact you and we can schedule such a consultation.
Yeah.
Okay. Okay, let's take a look at another one. What is the price of the egg donation program?
So the egg donation program is 3,090 euros. But this is a program with promotion, yeah, because in this program, which is the newest one, we guarantee 2 embryos. Normal package is 4,900 euros.
Okay, thank you. What affects the success rate of egg donation? Is it the age of the donor or the patient?
Both, really both, because the age of a donor is between 20 up to 32. And we know that the older recipient, the older patient, the worse results are really. So two things are very important, but the final result depends on the patient.
Okay. We have another one from Piotr. What maximum age are the donors and what is the medium age of the most of the donors?
So the maximum age of the donor is 32, and they are something like 25 years old because most of them has already finished their higher education or are just finishing studies. So these are all
Okay.
young women.
Okay, thank you. Which is more successful, fresh or frozen embryos? What is the cost of embryo donation? From Erin this time.
Frozen embryos with the success rate is in our programs about 60%. We perform frozen embryos transfers, we perform fresh embryos transfers, but usually with the first donation program, when you are starting, we are doing fresh embryo transfer, and the success rate is about 60%.
Okay, thank you. We have another one. Are the donors mothers with proven fertility?
Yes, these are women with proven fertility.
All right, perfect, thank you. Can you influence the DNA of the donor egg? I have read reports from Spain that the female carrying the baby can influence the DNA of the egg. From Joanne.
Yes, these are studies concerning epigenetics. Yeah, of course, in scientific research, we check scientists around the world check these possibilities. But as for now, we don't know it very well. So these kind of things are not checked all around the world. These are only scientific publications, scientific reports.
All right, thank you. We have another one from Ella. Is there a difference between frozen and fresh cycle in success? Recently, I have heard that it is better to do frozen cycle as there is a better chance to prepare a patient for transfer.
Yes, I agree that in frozen cycle, it is much easier to prepare patient, to prepare endometrium to achieve appropriate endometrial thickness, which says us whether the endometrium is ready to be given the embryo.
Okay, perfect. Thank you. Is it possible to prepare myself for an embryo transfer remotely with my OB gynecologist?
Uh, Theoretically, it is possible, but your gynecologist should be in contact with us. And if he or she is a specialist in reproductive medicine and does these things every day and have enough of experience, it is possible, but it may happen that if he or she isn't very common in this kind of things, there might be some problems with the endometrium thickness or preparing you with drugs, changing dosage of the drugs. So yes, it is possible, but in several circumstances.
Okay, thank you. We have another one from Aaron. Before embryo transfer, do you require hormone blood tests?
And generally, we are checking estradiol and progesterone. Yes, but not always. I don't know here what hormone blood tests you mean. We want to have all the hormone blood tests before our first visit, so it is possible to send them to our coordinators via email.
Okay, and we can of course check it. Okay, so you can give us some details, and we will be able to get back to you on that. All right, let's have another one. What do you mean by good embryo are the at the blastocyst stage?
Yes, the 5th day,
Of
exactly.
course. Okay. Are the embryos guaranteed on day 3 or day 5?
Yes, this is the same question we've got before. So generally, this is day 5, but sometimes, as we see, the development of the embryo, it can be also day 3.
It all depends, of course, right?
Yes.
Okay, let's check another one from Piotr. There is a significant difference in 3 and 5-day embryos. Do you have a program where you guarantee a certain number of day 5 blastocysts, good quality embryos?
So yes, it is in our program. It is possible that 4 embryos are guaranteed, but there's also a program with 2 embryos guaranteed, and all the information are available on our website.
Okay, thank you. Do you accept blood tests done abroad in European Union country like Spain or Italy?
Yes, we do.
Okay, perfect. Thank you. Why is it easier to operate the endometrium with a frozen embryo? Surely endometrial preparation is the same. It's from Eric.
Why is it easier to?
Prepare.
Okay, so when we want to, when we are preparing endometrium, or when we are having a frozen embryo, we can start preparing endometrium in a timeline that is good for the patient. And if we want to perform the fresh transfer, then we have to prepare at the same time the donor and the recipient.
Okay. Let's see another one from Ella. Do you have semen donors?
Yes, we have also semen donors in our Gyncentrum Clinic.
Okay. Is what you call the good embryo the same quality as top quality embryo?
Yes, this is the same.
Okay, thank you. And we have another one from Doris. How many fresh oocytes will I get for fertilization? Is there any guarantee for the number of oocytes?
We guarantee 4 or 2 embryos because from one donor we can have more oocytes, and we do not guarantee all oocytes from one donor. So these oocytes of one donor can be shared between few patients.
Okay, thank you. And there is another one from Ella this time. Are your semen donors only Caucasian?
Yes, also because these are only Polish men.
Okay, so it's the same as with
Yes, the
egg
same
donors.
as with women, exactly.
Okay, good. Thank you. And we have another one from Piotr. Are the donors exclusive donors? That means all the oocytes from this station will not be shared.
Are the donors means that all oocytes? It is possible that you can have all oocytes from one donor for yourself, yes, but this is extra paid. It is not guaranteed in every program.
And can you tell us a little bit how much that would cost, approximately, at least?
It depends on the amount of the oocytes. You like to have more, yes?
Okay, understood. All right, let's see if we have any more questions. I do see that someone is writing, so let's wait for a minute.
Yeah.
Okay, yes, we have another one from Erin. With fresh embryo donation, you synchronize the donor cycle with the recipient. Does this make the endometrial lining more difficult to prepare?
It is the matter of the doctor who is performing endometrium of the patient. So it is maybe a little bit more difficult, but we do it with success. So it's not a thing for the patient to worry about.
Okay, that is good to know, of course. Okay, I do see that someone is typing as well. So let's see. Okay. We have a question from Anne-Marie. How would I get tested in the UK for the endometrial lining?
So it's necessary to perform ultrasonography scan, yes. And it is also possible that when it's the beginning of your cycle, that you send us via email the ultrasonography scan.
Okay, fantastic. Thank you. We have another one from Mercy. The success rate, is that pregnancy rate, live birth?
The success rate is the rate of pregnancy, not live birth. Yes, because live birth depends on many different factors that was mentioned in our presentation. Really.
Thank you. Okay, let's check the next one. In fresh eggs programs, with the stimulation, will the eggs be shared, or will they all go to one patient? I mean,
They can all go to the one patient, but as I said, because it was mentioned a few minutes ago,
exactly.
all the oocytes can go to one patient, but it's extra paid. It depends on the number of oocytes, but generally oocytes are shared. But it is possible that they are all go to one patient.
Okay, good. Thank you. Do you have any clinics you are connected to in the UK?
No, we don't have.
Okay. Yes. And
But we've got a lot of patients from Great Britain.
okay, that's good to know, of course, as well. And let's see. Do you have a guarantee program?
Yes, we guarantee these 4 embryos, and there are also other possibilities, but all the details can be sent by an email, yeah, because it
Of
depends.
course.
What would you like to be guaranteed?
Yes, if you could explain a little bit more, of course, we will be able to answer. Okay, then let's have another one. Is your success rate for the cumulative cycles or for single cycles?
This is for single cycle.
All right. You have said that there is no BMI limit. Are there any additional tests to be done? My BMI is 35.
And we do not perform any additional tests here in Poland. We ask you about your general health conditions and if there are any other diseases, concomitant chronic diseases. All the consultations should be done in your own country, and then if there is any additional problem, you're asked to show us this kind of consultation, because we want to know that the pregnancy won't be dangerous for you.
Okay, thank you. We have another one from Erica. In your opinion, if somebody gets pregnant after a frozen cycle at age 44, what are the things she should be extra careful with? More than somebody who gets pregnant naturally at the same age?
Well, generally, there's no difference between a woman that is pregnant and she gets pregnant with frozen eggs and in comparison to pregnant naturally. So there's no extra things that the patient should be careful with.
Okay. And we have another one from Erin. Your oldest patient is 52 years old. Do you have many patients over 50? If so, are they all successful achieving a live birth?
No, we do not have many patients over 40. Most of our patients over 50. Most of our patients are over 40 years old.
Okay.
And the success rate depends on other things, not only on the oocytes, because oocytes are of the origin of young women. Yeah, so.
Sure.
But we have
Thank you.
pregnancies. Yeah.
Okay. How do you decide which patient should get which eggs? Is it possible that one patient gets the less good eggs?
No, because nobody will get less good eggs, because this is the amount that is guaranteed in our package. Yeah, so all eggs are good quality, and the things that are guaranteed, these are the embryos, 4 or 2 good quality embryos. And the matching is a very important part of our program, matching between the donor and the patient. But
Okay,
it is
perfect.
done with the coordinator.
Again, yes, of course. Okay, thank you. What is the average age of your patients for egg donation?
So they are all, I mentioned it before, these are the patients about 25 years old.
Thanks again. I do see again that we
I mean
have
the donors, yes, and the average age of our patients is about 40.
Okay, thank you. How many oocytes do you give to the patient in order to achieve the 4 guaranteed good quality blastocysts on day 5?
We do not give patients all sites to guarantee for good quality embryos. Yeah, we guarantee 4 embryos, and it does not depend on the amount of oocytes. If it's necessary, we perform more oocytes, more oocytes fertilization. We just have to have those 4 good quality embryos.
All right. Thank you. Which information do we get from the donors? Can we get the pictures of their childhood?
No, it is impossible because donation is anonymous.
Exactly. Okay. Thank you for clearing that up. And let's have another one. Is there strict phenotype matching in Poland? If I would like for my donor to be much taller than me, would that be possible?
Yes, and in some manner it is possible, of course.
Thank you. Let's see if we have any other questions. Okay, we have another one from. Okay, is it risky to get pregnant for a healthy woman at the age of 39?
Well, generally it is said that the pregnancy after the age of 35 becomes a little bit more risky. But healthy women, even in their 40s or later, become pregnant, and if they are healthy, it happens that there are no complications during pregnancy and labor.
Okay. Okay, we have another question. So you perform another simulation with the same donor in case we do not achieve all 4 blastocysts with the first stimulation program?
Yes, if we guarantee 4 embryos, the patient must be given 4 embryos. And it's on our side how we do it, but the patient is guaranteed 4 embryos.
Fantastic, thank you. And let me have a look and see. Doris is writing. There's another one, same donor. That would be same donor from Piotr.
Same donor, yes, of course.
Okay.
If you've chosen one donor, of course, same donor.
Okay, good. Thank you. How the paperwork looks like, what kind of documents would I have to sign to proceed? And is it possible to sign them without personal visit at clinic before the start?
We can send you all the documents that are necessary for us. You can sign it and proceed. However, you will have to come to us for the first visit, yes, and you have to be here by your own, so then we can also sign all those documents.
Okay. Thank you. I see again there are some people that are typing now, so let's give it another minute. Okay, let's wait a little bit. Doris,
Yeah.
I guess is writing. So. Yes, we have another question from Doris. I wonder if it's possible to send a frozen partner sperm. In that case, he wouldn't have to come to the clinic.
Well, it would be better if he come here just for one time, and then we'll freeze the sperm, we'll perform semen analysis, and then later on we'll use this frozen semen in our procedures. So we know that sometimes it doesn't work very good during the transport. There might be some problems, and we do not take the responsibility for the quality of this kind of sperm.
Okay, so it's advisable, to actually come to the
Yes, it
clinic.
is advisable to come to us.
Okay, good. Thank you. If the pregnancy rate is 60% and you guarantee 4 blastocysts, then it is most likely that a patient gets pregnant with 1 egg donation, since the patient gets 4 transfers and 4 times 60%. Do I understand it correctly?
Of course, 1 egg donation, but the success rate is 60%. However, as we know, our patients are very different, and we speak about egg donation program in older patients. So we must be aware that sometimes one transfer is not enough for the patient. Sometimes it is. But if we take the population of elderly women, it will be, of course, a little bit decreased.
Okay, thank you. And do you have double donation?
No, we don't perform double donation.
Thank you. And how strict is the matching process?
I don't know what do you mean by how strict, because we've got our own procedures. These are special charts. The patients are writing about their self. They are writing about their phenotype. We also look at the phenotype. We perform tests, blood tests, and so on. And the same things concern our donors. So we do it to perform the best similarity between our patients and the donors.
Okay, thank you. Piotr, of course, you can, if you like to add something, then please just write to us, okay? So we can double check it for you. And let's see, we have another question. Do you have embryo adoption treatment?
So if you want to adopt an embryo, it is also possible.
Okay, perfect. There is one more question from Piotr. Do you perform transfer of frozen embryos from abroad? Is it allowed, and do you organize the embryo transport?
Well, it is possible, but it is similar as with frozen semen, that we don't want to take responsibility for the quality of the embryos. We had cases that the embryos that arrived to us were not of good quality, and so the success rate was then not as high as we would like to. So we want to perform the procedures by our own.
Okay. Okay, there is another one from Piotr. What are the must matching features to be matched with the donor, like the blood group or phenotype
Yes,
features?
exactly. This is blood group, phenotype features, height, weight, color of eyes, hair, and so on.
Okay, it's. You said the double donation, egg and sperm donation is not allowed, but the embryo adoption is allowed?
You mean here okay, I wrongly understood. Yes, so it is possible that we've got the donation of eggs and sperm, sperm with the anonymous donor, and the embryo adoption is also allowed. But it can be, the embryo from donor's eggs and sperm of the donor. Yeah.
Okay. Okay, that explains it. Okay. What is the success rate of embryo adoption? I have heard it is cheaper treatment.
These are also embryos of very good quality. So the success rate is over 50%. Whether it's cheaper, it depends on what you would like to achieve. So if it's not possible to have your own gametes, I mean here, for example, sperm, when the eggs are of your own eggs are of very low quality, then you can use donor's eggs and your partner's sperm. Or you can have embryo adoption with donor's eggs and donor of sperm of the donor. So this will be a little bit more expensive.
Okay, let's see. Okay, thank you. And let's see if we have any other questions. I do not see any at the. No, someone is typing. So let's have a look. Do you recommend intralipid infusions? I know it is not evidence that for every.
In some cases, yes, we do
Thanks.
recommend, but these are patients after a consultation, after immunological consultation. So it is recommended by doctors of other specialty.
Okay, thank you. Okay, there is one more. Let's have a look. Okay, I meant embryo adoption, the embryo from couples that achieve pregnancy and donate their embryos to others.
Yes, it happens. Yes, we've got this kind of embryos from the couples that have already achieved their own pregnancy and they donated the embryos. Yes.
Okay, thank you.
Yes.
We will be slowly finishing, but I do see that Doris is still typing, so let's have a look. Yeah. Do you have additional procedures if the male factor is involved? I mean, procedures, techniques in IVF lab.
Yes, we do perform additional diagnostic tests and almost all procedures. These are ICSI procedures, so IXCI IVF technique for dedicated for the male factor.
Okay, thank you. Let's see if we have any other questions. Let's give it a minute. I can see that someone is typing. Okay, that is one from Piotr. Is the egg donation totally anonymous in Poland? I have heard it was not.
Yes, it is anonymous. It is
Only.
anonymous. Yeah.
Okay.
So you will have no information about your donor.
Okay, thank you.
Thanks a lot.
All right. Let's have a look. We'll see one more, I guess, and we will be finishing our Q&A session. Yeah. Okay. That will be our last question. Okay. And of course, if you will have any more questions, you can type it to write to patient@eggdonationfriends.com. We will be able to, of course, forward this to Dr. Katarzyna as well. Okay. For a woman at the age of 39 and two-fight IVF with own eggs and AMH of 8.9 and AFC of 12, do you recommend egg donation or IVF with own eggs?
Of course, it depends if what is AMH 8.9 because it might be in nanograms, for example. I don't know. So if it's nanograms and this is the antral follicle count 12 and even the age of 39, I would recommend IVF with her own donor, with her own eggs.
All right. Thank you. I hope that was helpful, of course. Okay, I guess
Thank you
we
very
will be
much.
finishing. So thank you everyone for participating in our webinar, and of course Dr. Katarzyna for answering and presenting this topic to us, explaining lots of things. I hope you had some answers for you, very good ones, I hope. Just remember that the webinar is being recorded, so you will be able to watch it online, and of course the transcription will be provided as well. I would also like to invite you to our next webinar next week, of course. Dr. Katarzyna, would you like to add anything else?
I think there were a lot of questions. I hope I tried to answer all of them. If there are any doubts or any questions, you should contact us via email or to call to our clinic, and our coordinator will contact you then later and probably we'll have a chance to meet each other here in Poland.
Of course, okay. Thank you
Thanks.
again for all your help. And as I said, if any of you have any questions, you can get back to us. If you'd like to speak with someone from the Gyncentrum Clinic, you can again get back to us and we will be able to forward all your questions. And have a very good night, everyone. Thank you again.
Thank you.
Bye-bye.
Bye.